Welcome back to Capsule Commentary, where today we're going over the story of Dennis Quaid and his twins regarding a medication error with the anticoagulant drug heparin. From what we know so far about the situation, the two 12-day-old infants were administered 2 doses of heparin over an 8-hour period, totaling the 10,000 units administered. The infants were originally supposed to receive only 10 units of Heplock instead. This error was largely attributed to the labeling and manufacture of the medication, but I'm sure we can find multiple steps along the administration process that led to the eventual error. To help us break down this unfortunate event and get some more insight on the situation, we have the Chief Nursing Officer and a representative of the State Board of Nursing joining us to answer a few questions.
Hello, my name is Sedona Stadelman, and I'm the CNO here at phsc Memorial Hospital.
And my name is Aiden Pothen. I'm a representative of the Florida State Board of Nursing, and I'm happy to be here.
Awesome. I'm glad to have you guys here so you guys can share your insight. To dive into it, we can start with how did this occur? What chain of events led to this medication error?
The manufacturer who created both medications labeled the medications similarly. The two medications have very similar bottles and labels, only varying in names and shade of blue. The phsc or automated drug dispensing machine was incorrectly filled with heparin 10,000 units instead of the Heplock 10 units. When the nurse gave the medication, she failed to read the label and make sure that it matched the order that was given versus what was being received by the clients.
Oh, okay. So it seems like there's a little bit of confusion there, but there's also some negligence. Do you think that there could have been anything done differently to prevent another med error like this from occurring?
We have learned many things from this medication error and realized that it could have been prevented if several checks had been followed. Since this error, we have implemented barcode scanning, which will help verify the medication is correct and limit human error when it comes to refilling the Pyxis, removing the medication from the Pyxis, and again before we administer it to the client. We have also learned that we must actively implement change based on the report of key specialty organizations, which allow us to prevent medication errors that have already occurred. In 2006, after the same error occurred in Indiana, the pharmacy department at Lucile Packard Children's Hospital at Stanford quarantined all 10,000 unit milliliter heparin solutions in the pharmacy, and all Pyxises were checked for the heparin 10,000 units, and the next week, all of those heparins were removed from the formulary of the hospital drug list, meaning that it could no longer be used in the hospital setting. I would also like to mention that there are channels of healthcare professionals and the public can use to report potential medication errors. These channels include MedWatch, which is a system to report concerns or medication defects by the FDA. Concerns can also always be reported to risk management systems within the hospital, and it is possible to address the manufacturer directly and state concerns. Other strategies that can prevent medication errors include tall man lettering used to distinguish letters and medications which look alike and sound alike, medication reconciliation, and verifying what medications the client is taking versus what the provider ordered.
Okay. So we've looked at the error and how it happened, and now we have a better understanding of that. I have another question. Do you think it's right to place most of the blame on the nurse who administered the medication?
While I do not agree that it was entirely the nurse's fault, the nurse ultimately was the one who administered the nearly fatal doses of heparin to the clients. The nurse is the final line of defense a client has in preventing medication errors, so while the manufacturer did label the medications too similarly, and the person filling the Pyxis placed the medication in the wrong spot, the nurse should have been paying closer attention before drawing up the medication and giving it to the clients. Nurses have a responsibility to ensure no harm comes to their clients. Nurses must verify provider orders to the medication record and to the physical medication before giving it to the patient in order to prevent errors from occurring.
Wow. So it seems like there's a lot of steps to the medic administration process. What is it that constitutes a medication error?
So, the Florida State Board of Nursing constitutes a medical error as a failure to implement a plan correctly or a wrong plan. Medical errors can include failing to inform a client of their healthcare plan and diagnosis or to the wrong procedure being held.
Oh, okay. What are some potential risks or results of medication error?
So medical errors are always very serious and can lead to the client receiving financial loss, lasting psychosocial effects, delayed treatment, and adverse effects, which may put the client's health at risk.
Oh, what else should we know about heparin? Can you give us a rundown over what heparin is and its side effects?
So I understand that you were a nursing student. What do you know about heparin?
Of course, heparin is an anticoagulant drug with the purpose of mainly preventing thromboembolic disorders. What that essentially means is it prevents blood clots from forming. It can be given subcutaneously or intramuscularly, and the different routes of administration result in different onset, duration, and peak times. Some side effects you might see with the patient taking this medication would be hyperkalemia and fever. For long term use, you might see osteoporosis and alopecia. And last but not least, you could see is anemia, which is the most common side effect.
Well, you explained that really well. In this case, you would absolutely want to monitor for bleeding. Heparin is labeled as a high alert medication as it can cause spontaneous bleeding throughout the body, including the internal organs such as the brain, nose, GI tract, lungs, and certain muscles. The nurse would want to monitor the partial thromboplastin time as it measures the time it takes for the blood to clot. The longer the APTT, the longer or higher risk the patient would have to bleed. The nurse would also want to monitor the platelet count. If an overdose does occur, it is important that the provider decides whether to give the antidote of protamine sulfate or to stop heparin's use, as heparin does have a short half-life. As Heplock is a form of heparin, the symptoms and considerations are similar, but the nurse would want to focus on the local affect of the site of the IV along with the APTT labs and monitoring for the symptoms.
Wow, that's a lot of information, a lot of stuff to remember. So, who holds the main responsibility to maintain and ensure safe medication administration?
So, as the Florida State Board of Nursing, we would say that the prescriber, the pharmacist, and the nurse are all involved in safe medication administration, but the nurse is a really important role. The nurse is the last line of defense and can monitor the patient's condition before and after medication administration.
Wow, okay. So, what are the roles of nursing in helping to prevent medication errors? What are the rights to med administration?
So every client has 10 rights to medication administration before they receive the medication. It's the right patient, right medication, which is ordered, right dose, right route, right time, right education for the med, the right assessment before receiving the med, the right to refuse, the right to proper documentation, and the right evaluation after receiving the med. There are also three checks that are important for patient safety, which include verifying the provider's order with what's shown on the medication administration record, or MAR, verifying the MAR to the medication at the physc, and verifying the right client to the MAR to the medication at the bedside. The rights and three checks are a systematic way to prevent errors and provide follow-up care. Along with the checks and rights when administering medication, the nurse does have autonomy, using clinical judgment to determine if the medication is safe for the client. This may include contacting the provider and clarifying with the provider, or it may include holding medication. For example, holding medications before surgery, or holding glucose if the client doesn't want to eat. As a part of the 10 rights, the nurse will also continue to monitor the client after administering the medication for patient safety.
Okay, so it seems like there's a lot of rights prior to medication administration and a lot of assessment even after. What is the procedure at PHSC Memorial when a medication error occurs? What are some of the first steps the nurse should be taking?
So, our policy when a medication error occurs is to first assess the patient and make sure that they are okay. Then we would report the incident to the charge nurse, notify the provider, and complete an incident report. The hospital will review and disclose the error to the patient's family or the client's power of attorney and appropriate organizations, including the FDOH. The hospital will continue to update and disclose to the patient and family as the hospital investigates the incident, and any disciplinary action that is necessary will be taken.
Okay. Is it important to consider the mental health of the caregiver who made the mistake as well?
So, as the Florida State Board of Nursing would want to view, um, as a general view for all hospitals, healthcare professionals, when they have traumatic experiences like this, it can really affect them with negative emotions and lasting psychosocial effects, including PTSD. It's important for the culture of the institution to be of a just culture, is what we would call it, so that we would look at the error and how all the systems were involved. because not just because we want to not hurt the feelings of of the healthcare worker, but because medical errors are often involving all the systems at play. So we want to address those and investigate those.
That makes a lot of sense. Putting all the blame on one person puts a lot of weight on their shoulders and probably does more negative than good.
Of course, and being able to fix that for future is the best way to do it.
Okay. Well, thank you guys for your time. I believe that will conclude our capsule commentary. So thank you guys.
Thank you so much, Dylan, for having us.
Bye-bye.